Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Heather Denniston to speak on the Webster technique and optimal fetal positioning. Heather is a seasoned chiropractor with specializations in pediatrics, pregnancy, and a certification in wellness chiropractic. She is the owner of First Five Consulting, a consulting group that ignites passion and inspires first steps in chiropractors during their launch years of practice. She's also authored the 3-Day Reset, a 3-day transformation food plan that is completely doable. She's a national speaker, an avid athlete, health enthusiast, and creator of WELLFITandFED, an online health and fitness blog. For further information, you can always find her at WELLFITandFED.com. Welcome, Dr. Heather Denniston, to the call. I'm so excited to have you on today.
Oh, thank you. It's an honor to be here, Doctor.
So I love having fellow chiropractors come on to the show to share more of the message, chiropractic message for family wellness. And today we're going to really focus on the power and value of chiropractic during pregnancy. And we'll cover things like the Webster technique as well as optimal fetal positioning, why that's important and, how chiropractic can help with that. So that's where we'll be headed. But before we get started there, I'd love to just have you tell our audience a little bit more about who you are, like why you chose to become a chiropractor, and what else you're doing currently in your with your mission.
Oh, you bet. I was in college and I had a terrible injury from a summer job that I was doing, and my sister dragged me kicking and screaming into a chiropractic office. I had no idea what they did, and if any idea, it was a bad idea of what they did. And so I had one adjustment, and the power of that adjustment not only corrected the issue but changed the course of my professional plan or life path, and I immediately went back to college and changed my direction. Just the hands-on approach, the holistic, non-medicated, loving sort of environment of a chiropractic office absolutely shifted my mind. And from there, I just went straight to chiropractic college and graduated in 1996 and started a practice just shortly after that up in Bellingham, Washington. So that's what took me into chiropractic.
I love that story. It's so cool. I mean, and it's actually kind of a familiar story in our profession where just because there's still like a lot of unknown about, in our culture, a lot of people are just still not really familiar with the benefits of chiropractic. And so it's, when people do have that type of miracle experience like you had, it really can inspire you. And I certainly knew people that were classmates of mine that were in school to become a chiropractor because of their own personal experience or a family member who also had maybe a really powerful, positive experience with chiropractic.
It's definitely more common than not, that is for sure.
Yeah.
We all seem to have had some sort of heart change in relationship to our love of chiropractic, and I love that about it because then it creates chiropractors who have a deep understanding of the benefit because they've experienced it themselves.
Mhm. Yeah, that's right. And I know I've shared in previous episodes that I'm a chiropractor because I've been under care my whole life. So I certainly also have, that personal experience of just ongoing preventive maintenance care, since I was in utero to optimize my nervous system function. So it's
Gosh, lucky you.
Blessed that I had that opportunity. I know. I'm so blessed.
Yes.
Very cool. So I also would love for you to just share a little bit about where you're currently at with your mission. I know before we got on the recording that you had talked to me a little bit about what you're doing, and I'd love for you to tell our audience as well.
Of course. I practiced in a full-time clinic practice, a practice that I owned with, I had an associate in the past and loved doing that. And so I ran a practice for about 20 years, and then I just recently sold it to a lovely two sisters from Wisconsin who have taken it over with loving hands and are doing a great job. And the reason I sold was because I was very, very clearly called to do some other projects, and one of those is to provide chiropractic care to nonprofit situations, people who can't afford or don't have the exposure to chiropractic care. And so one of my projects is I'm working with a community called REST in Seattle that rescues women from the sex trade and providing chiropractic care both for the volunteers and staff and eventually some of the young ladies that are working to get their lives back on track. And then in addition to that, I started a health and fitness blog called WELLFITandFED, and that has been just a labor of love in that I love to write, and I really enjoy writing about health and fitness and nutrition. And I have found as a chiropractor that patients often come in with either misinformation or information from sources that aren't necessarily qualified, and there is so much information out there. It is really hard for patients to sift through and know what is true, what is not true. So I felt very called to be a voice in health, nutrition, fitness, someone who's had some experience and has some qualifications that people can trust. And so that is what the WELLFITandFED blog that I started about a year and a half ago is all about. And in addition to that, my husband and I really decided this was a time in our lives where we wanted to travel extensively, and so writing the blog and doing the volunteer work has allowed me to do that. In fact, I leave for El Salvador in 2 weeks with a group called Spinal Missions. We're going to be delivering some chiropractic care to villages outside San Salvador, and I am just so looking forward to that, very excited. And being in a full-time practice, as much as I love and adore it, and I love delivering adjustments all day long, however, it didn't allow me to do some of the volunteer outreach that I really wanted to do and some of the writing that I really wanted to do. So that's where I'm at in my space in life at the moment.
Mm-hmm. It is just so beautiful. I am always so impressed when, there's colleagues that, volunteer to travel to other parts of the world and, or even like you said, in your own backyard and, and to offer, chiropractic care at no charge for people that are in such desperate need for this type of service and can't afford to pay for it. It's just
Absolutely.
Really beautiful work that you're doing.
Thank you. And I hope to do more of it.
Yeah, and I wasn't even aware of the group you mentioned, REST, but I mean, holy moly, like I just can't imagine, those women with the physical, chemical, and emotional stresses that they've endured in their life, how it's going to create so much stress on their alignment and their nervous system, and how beneficial, chiropractic care could be for that population.
Absolutely. I'm so excited because you're right. That is just such a primed population for receiving the type of work that we do. And I'm just so excited to just get my hands on as many as I can and just be a part of the solution for these young women really wanting to change their lives.
Yeah, to help with the healing. I mean, it's going to make such an impact. So I love that. So we're going to, thank you for sharing that. I'd love to switch gears now and to focus on our topic today, which is the Webster technique. I am finding more and more women are hearing about the Webster technique while they're pregnant, and either from online or their friends, or even now OBs and midwives are making referrals for Webster technique. So can you just first of all explain what is the Webster technique, and then we can also talk about, how that impacts fetal positioning and why that's so important.
Yes, of course. When a patient comes into my office asking about it, I always do a description introduction of what the Webster technique, and the response always is, it's that simple? And I say, yes, it's that simple. So the Webster technique was developed by Dr. Webster, and his intent was to help free up any torque or tension in the pelvis that might be resulting in an abnormal position of the baby, or might be causing the abnormal position of the baby. And so he, through trial and error and through working in a very detailed way, came up with a protocol that is applied to the pregnant mother and in a very gentle and non-invasive way. And what I love about it, doctor, is that Dr. Webster, instead of saying, let's force the baby into the right position, ask the question, why is the baby in the wrong position in the first place? Mm-hmm. And what I love about that is it allows the doctor, the chiropractor, to evaluate the mother, her pelvis, and the alignment of the spine and determine, is there something that might be causing this baby to not want to go head down? And in identifying that, we just found over and over and over again that typically there is one part of the pelvis, either on the right or the left side, we call it the sacroiliac joint, and it's that joint that if you look at the back of a body, the little dimples on either side of the buttocks there, right in that area, there typically is one side that is locked up, not moving, or slightly out of alignment. And so what we get to do is we adjust that area, we get it moving properly, and we get the nerves functioning at that level, thereby unwinding any torque or tension on the pelvis, and by secondarily releasing a little ligament in the front in a very non-painful way, we can open up that space for baby to get head down into the right position. And what we found is that the results are incredible. In fact, there was a study done, Journal of Manipulative Medicine, I believe, that talked about between about an 82% success rate in the Webster technique, and there really isn't any other option out there for women that can provide that kind of percent return on a procedure, you know. So that's, in a nutshell, what the Webster technique is. It's approach to the body to help unwind and untwist what's going on in the pelvis that is probably causing why that baby is in the wrong position in the first place.
Mm-hmm. Yeah, well said. And, you know, I've even seen, you know, closer to 85-90% effective rate with the Webster. So it can really be so effective. And, you know, there is definitely nothing 100% guaranteed with any type of, you know, thing. And there's reasons why sometimes babies don't respond to Webster. However, it is such a high percentage that do respond, and it's safe and non-invasive. And I think that's the other thing that's so important. It's not only effective, but it's very safe and non-invasive as opposed to external cephalic version, which I know we'll get into later. And and so this, you know, it's good for women to know that this is an option if they do find out that their baby is, whether the baby's breech or transverse or, you know, face brow or other non-optimal type of vertex position. Absolutely. And I love that it is really 1 to 6 visits, and it takes about 2 or 3 minutes to perform the adjustments, and it's very gentle, and patients are very, very satisfied with the outcome. So I love that about it. Yeah, me too. So, but let's talk about let's talk about why is it important for this baby to be in that head down vertex position. And let's say a baby is, but is still possibly, you know, face brow, for example, and not, you know, not facing the correct direction. I think a lot of women understand breech, transverse is going to be a scheduled C-section, right? And so if they're wanting to avoid that, they're going to understand we want to get this baby turned. But what about for other types of positionings? Like, why is that important?
You know, it's funny. I had a doctor in my area who, she's an obstetrician, and she kept sending patients over that weren't breech. And my traditional learning of the Webster technique 20 years ago was typically our best results are with breech babies. Well, she kept referring them over, and finally I called her and I said, I love that you're referring these patients and we're doing great work with them. I'm wondering what your trigger is. What causes you to do the referral? And she said, well, doctor, anytime I see these babies aren't in the most optimal position, I'm going to refer them to you because I'm finding that whatever you're doing is resulting in a more optimal position for labor. And so to answer your question, Dr. Laura, why do we need this optimal position? Well, anything less than optimal is going to, of course, increase the mother's risk of intervention. And so if the baby's position isn't optimal and then we need to go to forceps or we need to go to vacuum or we need to go to cutting or we need to go to a C-section, anything we can do to just put those way, way, way far out in the distance by creating a more optimal position for baby, that's a plus. And of course, no mother is going to disagree with that. So that is the primary reason we want optimal positioning, so that baby can just slide out in the best way possible, and we can avoid any of those more invasive procedures.
That's so true. You know, one example I want to share is perhaps some women have heard of either themselves or have had other friends who said, oh, the baby got stuck in the birth canal. You know, the woman's laboring. It's very painful, very intense. Things are not progressing as effectively as possible during the labor, and the baby is stuck now. And then it leads to an emergency C-section. And this is a story that I unfortunately, you know, have heard more than I'd like to say. And so when we hear these stories of babies getting stuck in the birth canal, that is almost always related to the alignment of that woman's pelvis. And that's what we're talking about, is how Webster technique can actually improve the alignment of the pelvis, so that it's the bony part is at its widest, so it's easier for the baby to come through the birth canal and not get stuck. And and that can, you know, like you said, not only help avoid other interventions, but specifically, you know, the ultimate intervention, which is the cesarean section. So if we can have less surgical birth because of pelvic positioning, it makes sense that would be ideal.
It does, and that leads us to another thought, and that is, let's say that baby is very resilient and doesn't end up in a breech position in spite of a pelvic misalignment in the mother. Well, then we end up on the laboring table and there's problems. And so my education to my patients and my potential patients is, let's not wait for the breech position. Let's make sure that pelvic alignment is sound, optimal for laboring, because in the end, it not only decreases the risk of those interventions, but it decreases laboring time, it decreases tearing, it decreases recovery time. And so regular chiropractic attention during a pregnancy is absolutely essential.
Yeah. And that's beyond whether there's back pain or not. I mean, a lot of pregnant women may experience lower back pain or upper back pain during the pregnancy because of the stresses of the pregnancy, the relaxin hormone, and just the way your body is changing so dramatically during the pregnancy. It's putting stress on alignment. However, that's the cool thing with this type of work as well. If you are having symptoms like pain, chiropractic can safely and effectively help resolve the pain. But even beyond, I have a lot of women coming to my office who aren't even experiencing pain, and also may not have a breech baby, but they are wanting to have an easier labor and delivery, and they understand that the alignment of their pelvis will directly impact the ease of the labor and how effective it is, like you mentioned, the length of time and less intervention. So for a woman who's wanting an unmedicated vaginal delivery especially, and wanting to have it as the easiest as possible, right? Having your pelvis in alignment through chiropractic is really an essential part of the lifestyle piece, and that would be in addition to the diet and the exercise and the meditation and all the other components that can help prepare you physically, mentally, emotionally for birth. I think chiropractic has to be part of that, and then bring in all the other great modalities as well, hypnobirthing and such.
Yeah, there are lots of great options out there, absolutely. And I just, they call it practice because you get to see all sorts of developments as far as patients, whether they're under care consistently or not, and what that looks like. And so you get to learn as a practitioner, wow, this has amazing results even beyond what I expected. And seeing these women who are diligent and determined to have their chiropractic adjustment every second week during their pregnancy or whatever the recommended care plan is, have them walk in straight up, standing straight up, no bent over posture, no back pain, no discomfort, really easy labors. It was just so encouraging, and I love being a part of that.
Yes. Yes, me too. Even another example that's coming to my mind is a second-time mom who had an emergency C-section, potentially because of interventions, and the baby got stuck and, whatever. Well, that woman has the same pelvis for round 2. And that second pregnancy, we may see either the baby is breech or once again, this woman is maybe just having an awareness now that she didn't even know of with the first pregnancy of how important her pelvic alignment is. And if she's really wanting to have a VBAC, one of the best ways to optimize the likelihood of being able to have a VBAC is by addressing pelvic alignment. So, and that's something I've seen a lot in my office where women perhaps did not receive chiropractic care with the first pregnancy and had maybe a really hard labor or, more interventions or possibly surgery, and are wanting to create a different story for the future births.
Yes, and isn't that just such a nice positive outcome to see that she's able to have a VBAC, and it's a positive experience, and, these women come in assuming that it's just not even possible, and I love being able to share that good news.
Yeah, exactly. It's not that your body is broken and that your pelvis is too small to birth a baby or whatever nonsense, they might have been told. Yes. So I think it's really important for women to take their power back and to really trust in the amazing ability of their body to birth. And then also to prepare for that, right? And there's so many ways to do that. So, in addition to chiropractic with the Webster technique, what other methods are out there that can help for optimal fetal positioning during pregnancy? Yep.
That's a great question. I think regular exercise is one that's very important. I know that's a no-brainer, but it's amazing how many pregnant women pull back really severely from any kind of exercise, fearing that might be problematic, and it's not. It's imperative to be continuing to be quite active, within the reasonableness of their particular pregnancy. In addition to that, acupuncture has had some great results. They've actually had some very nice peer-reviewed studies showing that moxibustion, and I'll explain what that is in just a moment, can be very effective for if there is abnormal lie, if there is a problem going on there, then the moxibustion treatment in acupuncture is great. And just regular acupuncture care is very relaxing, helps keep all the energy flowing properly through the body. So moxibustion, just in a nutshell, is a treatment that an acupuncturist teaches you to do at home, and it's just identifying a couple points on the outsides of the baby toes right next to the toenail where you apply this moxibustion stick, and what it does is it triggers a certain meridian that is very related to pregnancy and positioning. And so that's a nice option for someone who maybe has had breech birth in the past, or breech positioning in the past, or has breech positioning in the moment. So I really like the acupuncture. There are some definitely prenatal yoga, like you mentioned, the hypnotherapy, all of those things are excellent adjuncts to the chiropractic care for a really healthy pregnancy. And I think those are the main ones that I really, really promote and encourage my patients to be involved with.
Yes, and one more I would add is I really like the Spinning Babies website. Is that something you ever recommend? So, yes, spinningbabies.com also has some pretty cool at-home type of, things to do to encourage babies turning.
Yes, and may I just mention, I'm sorry, I'm so glad you brought that up, because very quickly we can just explain what those are. And really the idea is inversion, and to try to get mama's head down below hips. And there's a couple easy ways to do that: kneeling on a couch with hands on the floor, or on stairs. It's filling in the stairs, and this sounds crazy, but lying backwards down the stairs, head down. But of course you want a spotter in position. You want to make sure mama is protected. But that inverted position has been shown to be very, very effective. And so that's one definitely that I encourage. And lastly is Swimming and playful swimming. So we're doing somersaults, we're doing kind of twirly-whirlies in the water, and anything that takes the gravity off the body and allows baby to move around a little bit, that also has been shown to be effective. So thank you for bringing that up.
Yeah, I've also had women, and I know this is on the Spinning Babies website with the inversion using an ironing board, which I don't know how many people even have ironing boards nowadays, but
I don't recommend. I've had 2 patients break them, so I don't.
So you don't even recommend it
board anymore. No, it's just sort of the risk factor is too much. I like the stairs option better.
Right, and that makes sense. So, I mean, the whole point is what we're saying is having mom in a safe place where her head is below her pelvis, like you mentioned, and that is, I guess, really what we're looking at creating there is, like we mentioned with swimming, is an environment where there's less gravity pushing down on the uterus, and that can definitely impact, making space for the baby to turn.
And I want to mention it again, spinningbabies.com has some excellent written out instructions on all of those maneuvers, and so I do encourage listeners to go ahead and seek that information out.
Great. And so these are all like everything that we just went over were holistic, non-invasive, safe options for women in their 3rd trimester to encourage, that optimal fetal positioning. Do you mind just spending a little time, though, also addressing the obstetric option for breech positioning, external cephalic version, and maybe just explain a little bit about what that is?
Yeah, you bet. So external cephalic version is a medical maneuver that is encouraged to women who are breech, typically 37-ish week. If the baby has not turned, they're going to recommend that. And what it is they bring the mother in, there's sedation, and then the doctor attempts to physically maneuver the baby from the outside down into the proper position. Now, with a review of the statistics that are out there, it's anywhere from a 30% to a 65% success rate. However, in 20 years of practice, I literally can tell you I haven't had one woman who's had it done have it be successful. And so then my question is the stress on the mother, the chemical intervention of a sedative, the follow-up ultrasound that would have been unnecessary otherwise. We have to weigh that risk-benefit ratio and determine, is that a good choice for the mother? So external cephalic version, it's out there. It's an option. I recommend patients really do their research before they make a decision to embark on that, and don't just agree with the doctor to say, yeah, I guess this is the next step, because there are other alternatives out there. Right. And so it has to be a very thoughtful decision, I think, because of the amount of stress that it puts both on mother and baby.
Yeah, I agree. And, I even do have, at least in my area, there's a fair amount of OBs that don't even do the procedure, and because they just don't have enough experience, and so therefore they don't even necessarily recommend it. What I see, unfortunately, is if a woman is breech at 37 weeks, they just typically will, they might just schedule a C-section for her at that point, like at 39 weeks. So, this is one of those things where, it's great to know that these options do exist, and if your doctor does recommend an ECV, you can, certainly it's ideal to explore these other options that are more non-invasive first. Yes. I do want to share one story, though. I've had so many women come through my office with breech positioning, and a lot of them are referred by midwives or OBs in the area, or their friends have told them, or they found me online, and they're really wanting to avoid having a C-section. So they're, the baby's breech, and they're like, let's get this baby turned so I don't have to have a surgical birth. And one woman in particular was scheduled for a home birth. Which is, less than 1% of the births in the United States are home, but this woman was planning a home birth, found out the baby was breech and was so committed to doing whatever it took to get this baby to turn. She had been under somewhat regular chiropractic care, but we increased her frequency, and that is something I would recommend. If the baby is already breeching, you're already past, let's say, 34, 35 weeks, you're going to need to come in a few times a week to get the best results with the Webster technique in turning that baby. And so she started doing that. She was doing the moxibustion with the acupuncture. She was doing all of the spinning babies exercises we mentioned. She was even doing the hypnosis and visualizing her baby turning, which I also recommend. And this baby was not turning, and it was like, we were like, what's going on? And this woman was really a fit woman too. Like she was in great shape. She was exercising. So after several sessions of all of this work, she said, I'm going to try an ECV. And she actually drove from New Jersey to Connecticut to go to a specific doctor who had better, and that's the other thing, is all, doctors aren't created equal, right, including, with any type of work we do. So she specifically went to an OB-GYN who had a higher success rate with the ECV procedure. She had it done, and it worked. And I really think that the reason why that one was successful is she had done all of the other things first. And I really felt like she was prepared to have a better response. She did, and she was able to have, a home birth, and she was so thrilled. So, that's definitely not the norm, but that was a case that I saw in my practice. And so, sometimes there could be some value.
Yeah. I think you brought up a great point, and that is that if the patient decides to go for the version, if there is pelvic misalignment, the likelihood is it's not going to be successful. So
yes,
recommending that patients always try the chiropractics first and approach with the Webster technique. And if that's not successful, then other discussions need to take place. And I think we always have to go back to, why is the baby in the wrong position? And if it's not turning, the baby innately has a reason. And there is everything from cord issues to whatever it is. If we are just being told over and over and over again that baby doesn't want to turn, then we step back. And I think that's really important, to be respectful of that as well.
Right. And you just mentioned one reason why I've seen the Webster technique not be effective, and that's if the cord is very short. The other reason I have seen is the shape of the woman's uterus can also impact why a breech baby is not responding to all these other types of modalities, including ECV. Like, nothing can sometimes be effective, and that baby just stays in their breech position. And, there's still a handful of birth providers out there that will agree to do vaginal breech deliveries, but it's really become so rare. And I found out recently that there was a study that was done to show, because it was kind of interesting, like, why is nobody, learning how to do, why are doctors not learning how to do this procedure that they used to teach in medical school? Certainly there have been plenty of people that have been born vaginally that were in a breech position, and now it's just not really even presented as an option for the majority of women, at least in the United States. And it was based on a flawed study that happened where they were saying it was so dangerous to allow a woman to do a vaginal breech delivery that the standard of care for most OBGYNs is to only do a C-section, and they don't even a lot of times want to allow a woman to go into labor on her own. They want to schedule it, like I said, at 39 weeks. To avoid that labor process from starting. So, that study has been shown to be flawed. There was a documentary that came out called Heads Up that kind of explored, and it was a chiropractor in California that put it together, that explored kind of what's going on with that. And I mean, ideally, that's something that, you know, because it's so important to look at science and research and see what's going on. And when studies, you know, are creating a shift in how medicine is being practiced, and then the study is shown to be flawed, I think it's so important for us to reevaluate the standard of care here. And you know, my hope is that, you know, this will come back to medical school training and more midwives will be available to do these types of deliveries, because for some women, it should at least be an option for some women if they're medically, you know, able to do that. So that's something else I just wanted to throw out there.
And I think you hit on a good point, and that is that the mother needs to constantly be reminded that they are in charge of their birth plan, and that if they really want to labor to see if that baby turns, there are many doctors out there who would give them that option, and if theirs is not, then it might be an opportunity to interview other practitioners that might be a little more flexible. And I think that's very, very key for us as you know, providers, to keep encouraging mothers that you get to design your birth plan. And you have choice.
You have choice. And I mean, ideally these conversations of interviewing your birth provider and making sure that they're on the same page with you, you know, from a philosophical perspective, is ideal, you know, towards the beginning of the pregnancy.
Of course.
I also do see women, you know, coming in that they're like, oh my God, my doctor's telling me this, this, and this, and they're only, you know, a couple of weeks from their due date. And it creates, unfortunately, even more fear regarding the upcoming birth, because they're not happy with the care that they're receiving. And so this is something that ideally can be avoided if you are, as women, I recommend definitely actively and consciously interviewing your birth provider at the beginning, and not just assuming that once you get to the end of the pregnancy, the two of you are going to be on the same page.
Well, and asking those questions: if I'm breech, will I get to labor? You know, all the poor, you know, not the outcomes that you want, but you want to know what's going to happen if those outcomes do present themselves.
That's right. And ideally asking that in the beginning of the pregnancy.
In the beginning. Yeah. Excellent point.
Yeah, for sure. I think that's so important. And, you know, just having that awareness that the type of birth provider you're working with can ultimately impact the type of birth that you have. So it's really, you know, important to recognize if you're having a clear vision of what you want your birth to look like, then you want to surround yourself with practitioners that are going to help support you with that. And that's number one, obviously your birth provider. And then after that, it would be the other team of professionals like chiropractor, acupuncturist, massage therapist, yoga instructor, doula, that are going to support you in creating that birth plan that you want. Yeah. And I love the, I've seen in the last few years just a surgence of midwife presence, both within the hospital and outside. And I love that because they are such a great middle person, because they're more naturally minded, but yet they have an education background that is so extensive, and so their competency level you can completely trust. And I love seeing that around more and more and more. So that is a very valid choice, is considering a midwife. I completely agree. We have, in my area, just within the past couple of years, we've had 2 hospitals bring midwives into the hospital. And so this is a great option for a woman who maybe isn't comfortable having a home birth with a midwife, but does want to have a midwife as her birth provider, and doing that in a hospital setting. And because there aren't any birthing centers in New Jersey, you know, this is definitely like the happy medium of having that midwifery style and philosophy of care, respecting what's normal and natural regarding pregnancy and birth, and still being in, quote unquote, the safety of a hospital. If there is any complications that arise, you're there and can have, additional medical treatment if necessary. So that's exciting to see that. And, the latest research I saw was that only 8% of deliveries in the United States are done by midwives, whether it's at home or in a hospital. And I'd love to see that number much larger. In Europe, we see, that the midwives are doing 20, 30, 40% of all deliveries because, their specialty is the low risk type of birth, right? And that's who should be ideally birthing with a midwife. And the high risk pregnancies should be under the care of an OBGYN. And so I think that, as more women, especially in the U.S., are even aware that a midwife is an option for them, I am hoping that we can, increase that percentage of deliveries with midwives.
Agreed. That would be lovely.
Yeah, for sure. Definitely. So in conclusion, I just want to kind of wind up our interview, but I would love, do you have any last thoughts that you want to share with our audience on this topic today?
Yeah, I think just recapping on the fact that if you are pregnant or you're thinking of getting pregnant, seeking out the care of a qualified pregnancy certified chiropractor, it's important. All of us are trained in how to work with kids and pregnancy, but I do believe, having gone through the course myself, there's a lot of detailed information that is a benefit to have. So the ICPA for Kids.com, the number 4, ICPA4Kids.com, has a great opportunity to seek out a doctor in your area just by putting in a zip code. So, and that is a Webster certified or a pregnancy and pediatric certified chiropractor. So that's one thing I think people should take away. The other is a book by Jennifer Barham-Floriani. It's about Well-Adjusted Babies. It's one of the best books out there for women who are about to have a child, and it is just fantastic. Again, it's called The Well-Adjusted Babies, and it's by Jennifer Barham-Floriani. And you can go to her website and get it. You can get it on Amazon. So that is an excellent resource as well. And just if you do find yourself in a breech position, get to a Webster certified chiropractor right away. Don't wait. Even if it's just week 30, 29, 30, don't wait. Get in there, get evaluated, and determine if indeed pelvic alignment, nervous system dysfunction, if any of those things are playing a role, it can't help but help. So I think that's really, really important. So that's primarily the last thoughts that I have for listeners to take away today.
Thank you. All three of those were so valuable. And the website for Well-Adjusted Babies is welladjusted.co. And she's got some great information on her website. She's an Australian chiropractor who is really passionate about mamas and babies. And we sell her books in our office, and it's huge. It's a huge book. It's a Bible, but it's such a great resource, and it covers everything from pregnancy to birth to infant and toddler care, and just really giving so many different options that are holistic and safe and natural. And I just think it's
like a textbook. Yeah, it's like a textbook, and you can really look it up to whatever section you're interested in, be it vaccines or nursing or whatever you do. But what I like is she's constantly updating it, and so there's new editions regularly. And it really is the only resource I've found that 100% comes from a natural-minded model, and her intent is fantastic. She really wants what's best for mother and baby, and I've heard her speak, and she's fantastic. So that is a great resource.
Yeah, totally. I'm really so happy that you brought that up and let our listeners know that they can order this book. And, I actually give it to every baby shower I go to. I gift a copy of the book because I just think it's so valuable. And,
yeah, that's great.
It really blows away, what to expect when you're expecting.
Yeah, it does. It does, absolutely.
So it's great for the listeners to know that this is a great resource, and as well as the ICPA website. I've definitely have shared that website with the other podcast episodes we've done, and it's great to bring that out again. If you are looking for a chiropractor who specializes in pregnancy and pediatric care, that is the website to go to find somebody in your area who's received this additional training. And you just put your zip code in, and they will pull up doctors in your area, and that's a very trusted resource. So, Dr.
Wonderful.
Heather, thank you so much for coming on today and sharing your passion for chiropractic and pregnancy. And I think you had just so much great information to share with the audience. So thank you.
Oh, well, thank you so much. As I said in the beginning, it is an honor, and I really love the work you're doing. So thank you so much for your efforts on these podcasts. They're super helpful.
Thank you.